Okay, good morning. At the risk of this turning into the Konstantinos Varsalinos Appreciation Society, I also have a quote from him at slide 5. So there we will. I was the political consultant for the UK industry, the Electronic Cigarette Industry Trade Association in Brussels for the last 18 months or so, and I saw the TPD process from start to finish. And what I kind of want to do now is put this discussion that we're having into the framework of the Tobacco Directive in Europe, and kind of talk a little bit about how that's shaping the discussion and what we can do in a way to react to it. The journey so far, how did we get here? Well, in 2012, the European Commission put a few lines in a tobacco directive that said all nicotine-containing products should be regulated as medicines, a move that the industry was fairly clear would essentially take pretty much everything off the market. That was endorsed by the European Council, which is the meeting of all 28, it is now, member states, and it was also passed by the European Parliament's Committee on Public Health. However, the European Parliament plenary decided that it would like to take a different path, and it put in what became the beginning of a new structure. Now, there are things about that that are less than optimal. There's a nicotine limit that we don't think is necessarily the best way forward. There's an advertising ban, which we think will reduce the appeal. If we think about the Clive Bates conundrum, as people are beginning to call it.
There's only one.
There is only one. Then we see that maybe that might inhibit the ability of these products to benefit wider society. But it was a lot better than what had been rejected, which was essentially the outright removal of everything in 2 years. Then we went into the process called trial, which is essentially a behind closed doors negotiation by which the European Parliament and the European Council come to a final decision on how they would like the law to look. And we ended up with the Tobacco Directive that we all know and love today. So here are its requirements. It's best to start with things we do know, because there are a few question marks, and I'm going to come on to that in a moment. We know that nicotine solutions of above 2% will be removed from the market at the latest by 2017, by May 2017. We know there will be an advertising ban, but we also know that the EU only has the competence to regulate advertising which is, as they say, cross-border in nature. So that means television, that means radio, that means the internet, most importantly. But what it doesn't mean is billboards, it doesn't mean point of sale. We know there's going to be a health warning. That health warning will cover approximately a third of the pack, and each pack will come with an information leaflet on things like contraindications and statements on the idea that nicotine is addictive. Importantly, it will be forbidden to make claims on the packages. So on a package, according to Article 12, we won't be able to say that an e-cigarette is less harmful than a cigarette. There will be a notification, and this is where the big question mark comes in. I'll address it in a moment. There's the fear that if 3 member states ban refillable devices, then in theory the Commission can, by implementing acts, ban the category across the European Union. And flavourings have been left down to the member states. So the member states will look at that themselves, and there is a procedure for the rectification of cross-border disputes, which is something very technical called Directive 98/34. So what happens next? Well, the first thing that happens is the European Commission has to tell us what half of it means, and they'll do that by way of implementing acts, and there will be 2 of those. The first one will look at the product notification, which is essentially the kind of data that manufacturers are going to need to submit to the competent authorities in each member state in order to be able to continue to sell their products. Then they're going to look at refillables, and they have to review the safety of the refillable section by 2016. When they've done that, they'll have a whole job of reviewing market data that's been collected under the directive. So, for instance, there's a few clauses in there which essentially say the manufacturers or importers have to submit a wide range of data to the competent authorities on who uses them, sales numbers, preference for different social groups, and so on and so forth. And that data will possibly lead to a new tobacco directive or a new e-cigarette directive. And the Commission has to review the current directive after 5 years, but that was also true of the last one, and that took them 11 years. So we'll have to see how that happens. And here's the Farsalinos quote. So I haven't got a nice picture of him today, sorry. But he said so the TPD is just a vague approach to some requirements that are needed before putting a product onto the market. And the true impact of the regulation comes from the negotiations that have started now. They'll specify the tests, conditions, and requirements needed. But what is the industry doing for this? Well, here is what the industry is doing for this. The organisation I consult for, CETA, is working with the British Standards Institute on a standard for the collection and testing of electronic cigarette emissions. We have an in-house analyst called chemist called Tom Pruin, who's not currently in the room, but he is working very closely with BSI and doing some very interesting work there. And we hope to tie up with Konstantinos and the work that he's doing with AIMSA, which has, of course, set the first independently verifiable standard for e-liquids. We also are aware that the French Association, represented by Monsieur Dumas de Roli, who is sitting in front of me, are working on a more global standard. And by global, I mean in taking into account the whole directive with AFNOR, which is the French standardization authority. The Conseil Européen de Normalisation, which is the European Standardization Committee, are aware of the work that we're doing, and we hope to bring this to a wider audience among the member states. And what we need to do now is create a method by which we can all work together. There is a lot of work going on, as you've heard from people on the panel, and as you will continue to hear from other people in the room, but a lot of this is happening in isolation, and that's not the healthiest way for us to go about doing this. There needs to be a better coordination between the industry to make sure that what we get is harmonized standards, rather than disparate, kind of disjointed standards in different places. Now, let's talk a bit about what I think, as we're making those standards, what I think we should talk about. And I think, I reflect on the last 18 months, and I think, well, I've been doing this for 18 months, which in some circles would make me a veteran in this business. And we spent the whole time talking about what we're not. We started off with, we're not a medicine, or we're not a tobacco product, or we're not this kind of a product, or we're not that kind of a product. I like the approach of the French health minister, Marisol Touraine, who stood up in the French Senate and said, these aren't cigarettes, these aren't tobacco, these aren't medicines, they're their own category, and we need to define the rules for this category as if it is a separate category. Now that means that as an industry we need to stop talking about what we're not and start talking about what we are. And I think in order to do that we need to kind of think about what the core values that we're using to think about ourselves are. It's quite a disjointed sentence, but I think I got my point across. The first one is to promote innovation. I think that the fact that these things have come to market in the way that they are shows the absolute need for innovation in the nicotine market. And we should be very, very careful to make sure that we do not stifle this with a system that doesn't work for what we can't see. This is a very new emerging technology. We've really been told by standardization authorities that the part of the challenge is that the market is evolving so quickly that it's difficult to put sort of concrete provisions in place. The second one is standards need to be technology neutral. There is a plethora of devices on the market, and we need to make sure that those standards that we use for the whole category are adaptable to, say, a disposable one-piece device that's a closed system, all the way up to that device that Konstantinos has got there, which Delon is holding up now, which is a very, very nice piece of kit with very good electronics in it. So we need to make sure that everything can, there is a place for all these products in the market as that have different requirements, and diversity has been key to the success of what we've done. And thirdly, and most importantly, and touching again on what Clive said, we need to maintain the value proposition for smokers. It's all very well making a wish list of everything we may or may not wish to do, but if we destroy the value proposition of our product to our customers, then they will stop using them and start using cigarettes again. and that is the outcome that we need to avoid. I'm going to stop there because I think the most important part of this debate is to get everybody involved, and I think I've probably got more to learn from the people in this room than they had to learn from me. Charlie Hamshaw-Thomas, who's over there, is going to talk a little bit more about the UK situation, which I know he's involved with. And I welcome your questions and comments and suggestions on how we move forward together and doing something together that allows this industry to grow and thrive like it should. Thank you.